National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. One of the things that I encounter in my office from time to time is Lyme disease. Now, Lyme disease is a very difficult disease to diagnose, and so it can often be missed by a variety of practitioners, and honestly, even the standard testing for Lyme disease has variable accuracy, and so because of that, it can be a very, very difficult disease to diagnose, and it often gets misdiagnosed as other conditions. It's often referred to as the great imposter as far as infections go, and in fact, it's more of a condition than it is just a pure infection, and that's what makes Lyme disease such a difficult condition to understand, because you have initial infection stages at first. Sometimes you can, basically where Lyme disease attacks the skin, and sometimes you can see something called a bullseye lesion. That's the sort of keynote symptom, is that if you get bitten by a tick and you have this sort of round red lesion that has a white center to it, that's a good indicator that the tick was infected with Lyme and you've now contracted Lyme disease. Why that's important to know is the earlier you get antibiotic therapy for this, the better your outcomes are likely to be. And antibiotics are seemingly the best treatment that you can have for it. And ideally, if you can catch Lyme disease early, get the bacteria under control, you can prevent the later manifestations of the disease. Now, if you don't exhibit that lesion or that target lesion, it's sometimes difficult to know that you've contracted Lyme disease, and especially because early testing isn't always that accurate. So sometimes if you see that you've been bitten by a tick, try to save the tick, because you can actually get the tick tested to see if it had Lyme disease. And then if it did, what you can do is you can actually go and get antibiotic therapy to, again, treat the infection as aggressively and as soon as you can. It's very important to limit it, because what can happen with Lyme disease is, although you can have early symptoms, and sometimes they may be very minor, you may not even notice them, what happens is you then have a latent period, which can be weeks, months, or even years. And then after that, Lyme disease will typically come back and start affecting other tissues, but specifically a lot of joint and nerve problems. And so sometimes it gets mistaken for rheumatoid arthritis, MS, ALS, and a variety of other neurological conditions or joint conditions. And so because of that, Lyme can be very hard to identify and treat. These later manifestations can be very severe, very, very debilitating. And so again, trying to treat the Lyme disease as quickly as possible is really important. Now, if you do end up discovering you've got chronic Lyme, hope is not lost. There's a lot of stuff you can do to really help reduce the symptoms and progression of the condition. And a lot of that comes around, again, support of these tissues that are being attacked. And ultimately, because Lyme disrupts the behavior of your immune system, it's also important to ensure that you're supporting your immune function. So immune supporting herbs like astragalus and cordyceps mushroom can be very, very effective at helping to reduce, again, a lot of the fatigue, a lot of the weakness, and a lot of the other neurological complications that occur with the condition, as well as supplementing with things like coenzyme Q10 and carnitine, which allow every cell in your body to produce energy more effectively. And where that really ends up being important is in the immune cells that haven't yet been affected by Lyme disease, because those are the ones that are really going to manage your immune system and help your body fight the disease off. So it's really important, like I said, to always try and get assessed as quickly as possible if you do discover you've had a tick bite. The trouble is, many people don't even know they've ever been bitten by a tick, and they discover later that they do have Lyme disease based on some of their symptom presentation. Lyme disease, like I said, very difficult to diagnose. Try to get diagnosed as soon as possible so you can get the appropriate therapy and really reduce the chances of any long-term complications. And I hope that if you do have Lyme disease, some of the recommendations I made today, you can discuss those with your healthcare practitioner, see if they're right for you, and see if they'll help to alleviate some of your symptoms. If you found this video interesting for yourself, or you know somebody that might value the information in it, please share it with them. Subscribe to our channel. Any questions or comments you can post below. And always remember, knowledge is health.